Hi, I'm Kevin K. This video is for people without group insurance. I have a separate video that covers the details for people who do have group insurance. Let's get started. In this video, we're going to cover how you apply for Medicare and what you should do if you don't have group insurance. We'll also look at how Medicare Parts A and B work. This is a picture of a Medicare card. As you can see, it's red, white, and blue, and it'll have your name and your Medicare number on it. Now, if you're already receiving your monthly Social Security check, this card should be sent to you about 90 days before the month you turn 65. Keep in mind, Medicare starts everyone on the first day of the month in which they turn 65. So, for example, if your birthday is May the 24th, then your Medicare benefits will start May 1st. However, if your birthday is on the first day of the month, Medicare will actually start your benefits the month before. So, using May 1st as our example, your Medicare benefits would start on April 1st. If your card says Hospital Part A and Medical Part B, and you want both, then you should be all set except for getting your supplemental insurance in place. But if you're not receiving your Social Security monthly check just yet, and you're going to delay signing up for it, then you'll need to enroll in the parts of Medicare that you want. You can do that in one of three ways. Online at ssa.gov/benefits/Medicare, or you can call Social Security at 800-772-1213, or if you're feeling really adventurous, you can visit your Social Security office if you have a couple of extra hours to spare. Now, this is the Medicare and You book. It's kind of like an owner's manual, and just like an owner's manual, there's a lot of good information in there, and you're probably not going to read it. I understand it's over 120 pages thick, and most people can't find what they want out of that book. So I'm going to do you a big favor. I'm going to answer the most common questions that I get regarding Medicare, and I'll use the Medicare and You book as a reference. Now, when I get to something that applies to you, just pause the video and make some notes. Now, if you have any of these types of health insurances, you should sign up for Parts A and B when you're first eligible to avoid any late enrollment penalty. If you have TRICARE, then you'll want to enroll in Parts A and B when you first become eligible at age 65. If you have coverage through the health insurance marketplace, then you should sign up for Parts A and B at age 65. That's Obamacare or the Affordable Care Act. If you have a health savings account, then this applies to you. Let's look at how much your Medicare Part B will cost you. This is a chart called IRMA, which stands for Income-Related Medicare Adjustment Amount. Most people pay $144.60 a month for the Medicare Part B premium. But you can see if your income as a single person was greater than $87,000 a year in 2018, or if you were married and you made more than $174,000 in 2018, then you'll pay more than the $144.60 a month. Let's talk about Part A and Medicare. You can see that this deductible applies when you're confined as an inpatient in the hospital. Medicare will pay the entire hospital amount except for the entire $1,408 deductible. Now, this deductible operates on what's called a benefit period. In simple terms, a benefit period begins when you enter the hospital and it ends when you've been out of the hospital for 60 days in a row. Multiple hospital stays that are separated by more than 60 days will assess a new deductible. So, if you were discharged from the hospital on February 1st and you go back in 10 days later, that's less than 60 days. So you're still in the same benefit period and you do not have a separate deductible for that second hospital stay. But if you're discharged from the hospital on February 1st and you don't go back in until October 15th, that's more than 60 days. And a new benefit period will begin and you'll have to pay the deductible again. So if you're unlucky and you have multiple hospital stays in the same year, and they're separated by more than 60 days, you will owe that deductible again. Now, how about when you're not in the hospital? That's where Part B comes in. This is the medical part of Medicare. It's the 80/20 part. It pays anytime you see a medical provider. For example, it pays for doctor's office visits. It also pays the doctor when they come to see you in the hospital. You know how the hospital charges separately from all of the doctors that come to see you in the hospital. There is a premium for Medicare Part B, which is $144.60 a month for most people. There is also a calendar year deductible of $198. Now, Medicare will pay 80% after that deductible. You would pay the other 20% of the approved amount plus any excess charges. Now, the most important thing to remember and understand about Part B is that there is no cap on your 20% share. It's really important for you to understand that. Most of us who have individual insurance or group insurance, oftentimes our 20% share is capped for the year, such as you'll pay no more than $2,000 or $5,000 out of pocket for your 20% share. And then the company pays 100% after that. But with Medicare, if you're dealing with a $40,000 or $50,000 medical bill, which could happen with major surgery, your 20% share can literally run into the thousands of dollars because it's not capped. This is why wise people get supplemental insurance that covers their 20% share of their medical bills. When you're on a fixed income, you don't want to be surprised with thousands of dollars of leftover medical expenses. Now, the final slide covers Part D, which is for your prescription drug coverage. I'm not going to spend much time on this because there will be a separate video covering it. But briefly, it's a partnership between the Medicare program and private insurance companies. There are about 20 to 30 different plans available in most states. The simplest way for you to choose the best plan for you based on your prescriptions is to go to the Drug Plan Finder on Medicare.gov. Once you watch the Part D video, it'll go into much more detail about this. Now, let's look at what we covered. Remember, unless you're already receiving your Social Security check each month, you're going to need to sign up for Medicare. You now know how to do that. You should also know the basic differences between Medicare Part A and Part B. Our next video is going to cover the difference between original Medicare, which we just learned a little bit about, and an alternative to receiving your Medicare benefits called Medicare Advantage. If you have comments or questions, please leave them in the section below and let me know what you think about the videos. One last thing, please click subscribe so you'll have access to all the videos in this series. And feel free to share this